My name is Ariane, and I did my video on hiatal hernias. So for the first question, the pathophysiology of the disease, the esophagus travels down through a hole in the diaphragm to get to the stomach. This hole is known as an esophageal hiatus. Therefore, a hiatal hernia is a herniation of the portion of the stomach into the esophagus through an opening or hiatus in the diaphragm. Hernias occur when the muscles become too weak, allowing the organ to protrude through the muscle, causing that bulging. Hiatal hernias occur when the muscle in the diaphragm becomes weak at the esophagogastric opening, which allows the stomach to push up through the esophageal hiatus into the diaphragm muscle. This can be done from a couple different things, such as excess pressure on the area, like obesity, pregnancy, heavy lifting, aging, because everything just starts to deteriorate and stretch out, and then also trauma to that area. For diagnostic testings, there's two tests that they can do. That's the barium swallow test, which is when a patient just drinks barium sulfate, and they get an x-ray of pretty much just this part of the body, and it just kind of shows if there's a hiatal hernia or not, and if it's like wrapping around anything. If they can't for some reason get it on that, they can always do an endoscopy, which is when they take a little tube and place it down the patient's throat. It has a little camera on it, so it takes video and images of everything that's going on into the throat. So it's a little more invasive. So clinical manifestations of hiatal hernias. So when a hiatal hernia occurs, the symptoms often cause the patient to experience GERD, so they'll have symptoms like heartburn, reflux, bloating, they'll belch a lot, they can have pain in the stomach or even the esophagus area. However, some people may be completely asymptomatic depending on how big the hiatal hernia is, and they just might not be aware of the condition at all. These hernias can also cause quite a few complications that can be serious. So again, GERD is always one. Esophagitis, hemorrhage or erosion, narrowing of the esophagus, which is known as stenosis, ulcerations of the herniated portion of the stomach, so like a break in the skin causing it to bleed and it's very painful, strangulation of the hernia just because of where it's at, and regurgitation of tracheal aspiration, so choking. Interprofessional care that would be provided for a patient with a hiatal hernia. So there are a couple of things nurses should be aware of when they're caring for a patient with this. One, they always want to help alleviate the symptoms. Symptoms of GERD are very irritating and can happen all day, and they're very uncomfortable. So just teaching the patient not to eat spicy or greasy foods or a lot of fatty foods. Don't eat 3 hours before bedtime or laying down. Teach them to, just graze instead of eating big meals. Don't drink water with meals. Try to drink water before meals or after meals so that their stomach doesn't get filled up with water and cause that regurgitation or reflux to happen. They can always educate on, we want to just do our best to relieve the pressure that's happening on the hernia. So advise patient don't lift heavy objects, not to strain themselves, wear loose clothing. So don't, if it's cold outside, which doesn't really happen in Arizona, but turtlenecks, things like that, because it can cause that pressure even more, and even sleeping can cause that too if you're laying on a pillow that's really bulged up against your neck. Lastly, we can always educate on medication. So care would be to just educate them on medication that's provided over the counter, even prescription wise, so like antacids, and then also educate them on possible surgery. If they do need surgery, go ahead and advise them of everything that's going to happen for that. Treatment plan and medication. So surgery, of course, is always the last option, but we want to do less invasive. So NSAIDs to reduce inflammation and pain. Patients can always use over-the-counter antacids to help with heartburn and reflux. And then sometimes patients will actually be put on nitrates, calcium channel blockers, antidepressants, which will all decrease the lower esophageal sphincter pressure. And then again, just changing their lifestyle, losing weight, becoming more active, and changing their diet up will help a lot. The use, use the nursing process to develop a care plan for the patient and also patient education. So the most important thing to note with these patients is that hiatal hernias have a really high risk of aspiration, so choking, because the stomach is, being pushed up. It causes everything to come up. So we definitely want to just help them to not choke on anything, which is, educating them again on diets, and not laying down after eating is a huge one. On top of this, we want to use the least invasive strategies first. So, it should always revolve around setting goals on how the patient will change their diet, how the patient will lose weight, how the patient can take over-the-counter medications. Another goal would be to teach the patient how to sleep. So making sure that they're elevated, making sure they're not eating before sleeping, things like that. Another thing that we could do is set a goal to help them to know when to eat, so like grazing instead of eating huge meals. Again, not drinking water beforehand. So really the nursing plan is just kind of to alleviate all those symptoms from the GERD, monitor for all of the complications that can possibly happen, educate them on possible signs and symptoms of those complications that can happen, and just educate them on, living with this, or if they do need surgery, we can educate them on the surgery that's going to happen and what options they have, because there's 2 different types of either like pushing it back down or tying it off and things like that. So overall, there's a lot of patient education, and there's a lot of over-the-counter and lifestyle changes that a patient can do for hiatal hernias.